Today we explore squat biomechanics through the calm lens of exercise science. The squat is one of the most powerful compound movements in strength training. Nearly every lower body muscle contributes during a properly executed squat. Understanding biomechanics helps athletes train harder while reducing injury risk. Think of the squat as coordinated motion across multiple powerful joints. The hips, knees, and ankles work together through controlled triple flexion. During descent, these joints flex to lower the body's center of mass. During ascent, extension returns the body to standing position. This coordinated extension produces the upward force needed to lift. The primary muscle responsible for knee extension is the quadriceps group. These muscles straighten the knee during the upward phase. Meanwhile, the gluteus maximus generates strong hip extension. Glutes are among the largest and strongest muscles in the human body. Hamstrings assist the glutes in stabilizing and extending the hip. Although hamstrings cross the knee, they mainly stabilize during squats. The adductor magnus also contributes significantly to hip extension. Many athletes underestimate how important adductors are during heavy squats. At the ankle, the gastrocnemius and soleus stabilize the lower leg. These calf muscles control forward tibial movement during descent. Strong ankle stability improves balance and efficient force transfer. Now consider the trunk, which must remain stable under heavy load. The spinal erectors resist forward collapse of the torso. Core muscles create intra-abdominal pressure to stabilize the spine. This pressure functions like an internal lifting belt for protection. Proper breathing technique is essential for spinal safety. Athletes typically inhale deeply before initiating the descent. Then they brace the abdomen to maintain trunk stiffness. This bracing improves force transmission from legs through the torso. Now let us examine the eccentric lowering phase. During descent, muscles lengthen while controlling the downward motion. Quadriceps control knee flexion through eccentric contraction. Glutes control hip flexion, preventing the body from collapsing downward. This controlled lowering stores elastic energy in muscle tissue. Elastic energy contributes to force production during the ascent. The bottom position is called the deepest squat depth. Here, hip and knee flexion angles are at their maximum. Maintaining neutral spine alignment is critical at this point. Loss of lumbar stability increases shear stress on spinal structures. Athletes must maintain tension throughout the entire movement. Now begins the concentric phase, which lifts the body upward. Glutes fire powerfully to extend the hips. Quadriceps extend the knees, generating most upward force. Hip extension and knee extension occur almost simultaneously. This synchronization is essential for efficient movement mechanics. Poor coordination may cause the hips to rise too quickly. This error is commonly called the good morning squat pattern. It shifts excessive stress onto the lower back. Balanced joint extension prevents this biomechanical mistake. Bar path also plays a major role in squat efficiency. Ideally, the bar travels vertically over the midfoot. This alignment keeps the system balanced during the lift. Forward bar drift increases torque demands on the lower back. Maintaining midfoot balance reduces unnecessary mechanical stress. Stance width also changes muscle activation patterns. A wider stance increases adductor and glute involvement. A narrower stance tends to emphasize quadriceps more strongly. Toe angle affects hip rotation and knee tracking. Slight external rotation often improves hip joint clearance. This allows deeper squats with stable spinal alignment. Mobility also strongly influences squat mechanics. Limited ankle dorsiflexion often causes excessive forward torso lean. Hip mobility restrictions may reduce squat depth. Athletes should maintain regular mobility training. Dynamic warm-ups prepare joints and connective tissues. Strong movement patterns reduce injury risk significantly. Another key concept is joint torque during squatting. Torque represents rotational force around each joint. Knee torque increases when knees travel further forward. Hip torque increases when the torso leans forward. Proper technique balances torque across hips and knees. Balanced torque distributes load safely across muscles and joints. This is why technique matters more than lifting heavy quickly. Slow, steady improvement builds resilient movement patterns. Training volume also influences squat adaptation. Higher volume promotes muscle hypertrophy and endurance. Higher intensity improves maximal force production. Athletes must balance intensity with recovery capacity. Sleep plays a crucial role in muscle repair. Adequate protein supports muscle protein synthesis after training. Carbohydrates restore glycogen used during intense lifting. Hydration also supports neuromuscular function and recovery. Let us now consider squat depth variations. Partial squats involve smaller ranges of motion. Parallel squats reach roughly 90 degrees knee flexion. Deep squats involve greater hip and knee flexion angles. Research suggests deeper squats activate glutes more strongly. However, mobility and control must support deeper positions. Athletes should only squat as deep as control allows. Another factor is bar placement during barbell squats. High bar squats position the bar above the trapezius. This typically encourages a more upright torso position. Low bar squats place the bar slightly lower across shoulders. This shifts more mechanical demand toward the hips. Powerlifters often prefer low bar technique for heavy loads. Olympic lifters usually perform high bar squats. Each variation has unique biomechanical advantages. Athletes should choose based on goals and anatomy. Finally, remember that strength develops gradually. Consistent technique practice builds efficient motor patterns. Over time, the nervous system improves coordination. This allows greater force production with less wasted energy. That is the quiet science behind powerful squats. Train patiently, and the body adapts remarkably well. Like a turtle, athlete progress happens steadily over time. Slow, controlled practice creates long-lasting strength. Respect biomechanics, and your squat will become powerful. Respect recovery, and your body will stay resilient. Strength training is truly applied human physiology. The squat remains one of its most beautiful demonstrations. And that concludes our calm exploration of squat biomechanics. Understanding mechanics transforms squatting from effort into intelligent training. The body becomes more efficient when movement patterns are practiced consistently. Motor learning allows the nervous system to refine complex coordination. With repetition, the squat begins to feel smoother and more powerful. Another key biomechanical concept is the center of mass. The center of mass should remain balanced over the midfoot. If it shifts forward, the lifter must compensate with spinal stress. If it shifts backward, the athlete may lose balance entirely. Balanced force distribution allows muscles to work most efficiently. Now, consider the role of connective tissues in the squat. Tendons transmit muscular force to skeletal structures. Ligaments stabilize joints by limiting excessive motion. Training gradually strengthens these supportive tissues. However, connective tissues adapt more slowly than muscle fibers. This is why gradual load progression is so important. Sudden increases in training intensity increase injury risk. Patience remains one of the most valuable traits for athletes. Let us briefly discuss muscle fiber recruitment during heavy squats. Fast twitch fibers activate as loads approach maximal intensity. These fibers generate high force but fatigue quickly. Slow twitch fibers contribute more during lighter, controlled repetitions. Balance training develops both endurance and maximal strength. Proper recovery ensures these fibers rebuild stronger than before. Nutrition plays a central role in muscular recovery. Protein provides amino acids needed for tissue repair. Carbohydrates replenish muscle glycogen after intense sessions. Healthy fats support hormonal balance and cellular health. Hydration maintains proper neuromuscular function during training. Sleep remains the most powerful recovery tool available. Deep sleep supports growth hormone release and tissue repair. Athletes who respect recovery tend to progress more consistently. Strength training is not simply lifting weights repeatedly. It is a careful balance between stimulus and recovery. When this balance is maintained, the body adapts remarkably well. Over months and years, the squat becomes stronger and more stable. Biomechanics simply guides us towards safer movement patterns. The science of training rewards patience and consistency. Every controlled repetition strengthens both body and technique. In time, the squat becomes a demonstration of disciplined practice. And like a wise turtle athlete, progress arrives steadily and surely.